Hello everyone, welcome back to my channel. I'm so excited for today's video because we are doing a question answer session related to radiology topic. Alright, let's move into the first question. What code describes a CT scan of the abdomen with oral contrast? Option A 74175, option B 74170, option C 74150, option D 74160. As we discussed earlier, if the contrast is given by oral or rectal means, then it will be considered as without contrast. So we have to pick the code for CT scan of abdomen without contrast, right? So the correct option is 74150. Next question. 62 years old female presents for a magnetic resonance imaging of the brain because of new seizure activity. After imaging without contrast, contrast was administered and further sequences were performed. Examination results indicated no apparent neoplasm or vascular malformation. So, what is the correct code? Before solving this question, I'll tell you some important tips related to CPC examination. First one, time management is the key to success in your examination. So, please try to solve the questions within 2 to 3 minutes. So, here we have two CPT codes, that is 70543 and 70553. Let's check the description of these CPT codes. First, 70543. So it is for magnetic resonance imaging, orbit, face and or neck without contrast materials, followed by contrast materials and further sequences. This is not correct, so we can eliminate the options with 70543. So option A and B is not a correct answer, so we can eliminate these two options. 70553 is magnetic resonance imaging, brain including brainstem without contrast material, followed by contrast materials and further sequences. Both options C and D, we have 70553. So we have to check the diagnosis codes in our ICD-10 book. So let's check the code R49.0. So it is for dysphonia. It is not given in our chart. So option C is remaining. So that is the correct answer. For confirmation, let's check the description for R56.9. That is for convulsions and for seizures. So it matches exactly. Next question. The patient undergoes a gallbladder sonogram due to epigastric pain. The report indicates that the visualized portion of the liver are normal, no free fluid noted within Morrison's pouch. The gallbladder is identified and is empty. No evidence of wall thickening or surrounding fluid is seen. There is no ductal dilation. The common hepatic duct and common bile duct measures 0.4 and 0.8 cm respectively. The common bile duct measurement is at the upper limits of normal. So first we have to check the CPT codes. We have 3 codes here, that is 76700, 76705, 76775. Let's check the CPT code 76700. It is for ultrasound abdominal real time with image documentation complete. So let's keep this option as of now. And the description for 76705 is ultrasound abdominal real time with image documentation limited. Example, single organ quadrant follow-up. Keep this as well since it is also abdominal, right? Let's check the 76775. It is for ultrasound retroperitoneal. Example, renal aorta nodes real time with image documentation limited. So it is not a correct option, so we can eliminate it. And option D is same as option B. Here we have the examination of gallbladder and the portions of liver only, right? Gallbladder is an abdominal organ. So if you are examining the single organ of abdominal cavity, then we can use 76705. So we can eliminate the code 76700 and we have to check the ICD code now. So for epigastric pain, the correct code is R10.13. So option B is the correct answer. Next question, clinical symptoms ascites, CT of the abdomen and pelvis. Technique, CT of the abdomen and pelvis was performed without oral or IV contrast material per physician request. Findings, no ascites, moderate sized pleural effusion on the right abdomen. So let's check the options. Option A 74176, option B 74160, option C 74150 and 72192, option D 74177. So here we are not having any ICD codes or modifiers to eliminate the options easily. So we have to check the description of the procedure codes. So let's check the options one by one. Option A 74176. It is for computer tomography, abdomen and pelvis without contrast materials. So in our question also we are having the same. So let's keep this option. We'll check the next option, that is 74160. It is for computer tomography abdomen with the contrast material. So it is not correct. So we can eliminate option B and we'll check option C. 74150. It is for CT abdomen without contrast. 72192 is for CT pelvis without contrast. In our question, we are having both the procedures, but as we all know, we have a combo code for this procedure, that is 74176, right? So we can eliminate this option. Correct answer is 74176. For confirmation, we'll check the remaining option, that is option D, 74177. It is for CT abdomen and pelvis with the contrast. So we can eliminate this as well. Next question. Examination of brain. Clinical finding. Headache. Computer tomography of the brain was performed without contrast material. Findings. There is a blood within the third ventricle. The lateral ventricles show mild dilatation with small amounts of blood. Impression, acute subarachnoid hemorrhage. So we'll check the options. Option A, 70460. So it is for computer tomography, head or brain without contrast materials. It is for computer tomography, head or brain with the contrast materials. Here we have without contrast material, so we can eliminate this option easily. Next option is 70250. It is for radiological examination, skull less than 4 views. So it is incorrect, so we can eliminate it directly. Next, check option C, 70450. It is for CT head or brain without contrast material. So it matches exactly. So let's keep this option. In option D, we are having 70450, same as option C, along with modifier 26. So we'll check the scenario. Here we are not having any professional components, right? It is not performed by the physician, so we can eliminate this option by seeing the scenario. So the correct answer is option C, that is 70450 I 60.9. You can also check the ICD-10 code as well to confirm the diagnosis. That's all about today's video. Thank you. If you have any clarifications, just mention it in the comments. And if you like this video, please share, like and subscribe to my channel. Bye bye. See you in next video.